Welcome to the Leadmore podcast. I'm your host, John T. Meyer. I'm super excited for you to listen to episode 6, my conversation with Dr. Lon Kightlinger. Dr. Kightlinger served as the South Dakota state epidemiologist for 20 years before retiring, but then deciding in his retired age that he was going to go across the world and serve in the Peace Corps in Madagascar, a place where he has roots, and you'll hear that story. I really admire Dr. Kightlinger's willingness to get uncomfortable, to seek a new adventure, and his passion for public health. He's the appropriate person to talk about the subject that we're all consumed with these days, the coronavirus. So we talk about that. We talk about what we can do as individuals and as leaders to get us through these hard times. And Dr. Kightlinger just really inspires me. So I think you'll enjoy listening to him. So tune in here as we sit down with Dr. Lon Kightlinger. Welcome to the Leadmore podcast, Lon. Thanks for being on the show today.
Well, thank you. I'm in pure South Dakota, so
good to be back home, huh?
Yeah, it's good to do this from a distance, I guess. In the day of COVID, we do this rather than meet. But
Yep.
Not too long ago, I was about 11,000 miles from home, and now I'm back here in South Dakota again.
Well, let's start there. Let's retrace your steps. So you grew up in rural South Dakota in Selby. You went to, before Augie, then you went to the Army, right?
No. I grew up in rural South Dakota, north central South Dakota. Then I went to Augustana, and then I was drafted, which always confuses everybody because all you young people think, oh, if you went to college, you didn't get drafted. Well, they ended the college deferment, so we were sucked out of college. So I did 1 year at Augustana, and then I had a low draft number. They did it by lottery back then, and I saw my birthday come up as number 11, and I knew I'd get a letter from the president, and I did. So
interesting. Okay, and off you went to where?
Off to Fort Leonard Wood for basic training, and then they trained me as a medic, and then they assigned us. I thought I was going to Vietnam. That's why they had the draft, but they sent me to Germany. So I was in Germany, West Germany at that time, close to Frankfurt.
Okay.
I was a medic.
And so I guess, what did you study that first year at Augie? Did you plan on going the medical route?
Oh, yeah. I was studying biology and chemistry. So I've always been into science. That's been trajectory from birth.
Okay. And then, you came back to Augie, or help me unpack, because I'm trying to figure out how you eventually got to Madagascar.
Yeah.
I know the story, but.
Yeah. So when you're drafted, it was 2 years. So you were 2 years and they could do anything with you that they wanted. So my intent was to go back to college. So I went back to Augustana and finished up 3 years there. And then I spent a year at Rapid City Regional Hospital and did the laboratory internship. So I was certified and licensed to run a clinical laboratory. And then I went finishing that, and then I was intrigued by the world, and I went to Madagascar with the Lutheran Church at that time. I thought it would be for 2 years, ended up being 20 years. You get something that just claws at your heart and your intellect and your soul, and you just find a vocation there. And so it was 20 years then.
That's where your son was born, and it became a big part of you.
Oh yeah, absolutely. You learn the language, you learn the culture, you learn the diseases, and you learn what's making people sick. And that's how I was converted from like clinical medicine, working in a hospital or a clinic, into public health, because, oh my goodness, you have, people would come into the hospital with malaria or parasites or some disease or malnutrition, all preventable. And then they'd get fixed up, and then 3 months later, they were back with the same situation. So I became, a very early eyewitness and, just convinced of the value of public health. And that's where I veered off and did a master's degree and did a PhD.
That's so great.
Yeah.
And I read the recent, in the alumni magazine from Augustana. I didn't go there, but I saw the magazine that talked about your story. And it talked about your value in public health and everything from really educating communities and mothers about breastfeeding to, people would come in with these diseases that you knew could be treated if they just had a little more knowledge and resources. So how did you develop that passion?
Well, I guess getting my well, I guess going back to my undergraduate at Augustana, they at that time they offered a J term or an interim course, 1 month to East Africa. And since I was on the GI Bill and working at McKennan Hospital at the time too, I saved up money and I went on that and just, found the whole African experience just, so compelling, so interesting, so vital. So I wanted to go back and, got back. I went to Madagascar, not Kenya or Tanzania. And, just within a few weeks of working, like seeing malaria on a microscope slide or seeing in poop samples just 5 parasites in a little 3-year-old child that was eating its nutrients, right out of its gut. And, what would solve that? Well, not a trip to the hospital, but like an outhouse, a latrine, some hygiene, so much malnutrition that could be, easily ameliorated with some better nutrition and better hygiene. Just so much to do in a poor country.
Yeah.
And vaccination. Wow. We can't forget that.
Yeah. So you did 20 years in Madagascar, right? 2 decades?
Yeah.
And then came back home, back to the prairie in South Dakota, where you then became our state's epidemiologist.
Right. Yeah.
And how did that experience in Africa prepare you for South Dakota? Did it help you, or was it complete? I mean, they're very different places.
Once you're into science and you study these things and get to know them, it's all kind of, you use the same tools, you use the same mental tools, the same, wherewithal to work it. It's just the magnitude of things. For example, in Madagascar, they bring in a tray of tuberculosis sputum they call sputum samples.
Okay.
And there'd be 20 of them in a day. Well, here in South Dakota, we probably have 20 tuberculosis cases in a year. So and malaria. We've never had malaria in South Dakota since Lewis and Clark came through here, really. And there it's just, oh my goodness, the children that died of malaria and malnutrition. And polio was rampant when I first went to Madagascar in 1978.
Wow.
So many polio cases. And now today, thanks to the vaccine and a worldwide effort, not just in Madagascar, Madagascar has been almost 7 years now polio-free, and there's only a few cases now left in Afghanistan and Pakistan, and the situation in those countries. So it's not just taking care of my body or your patient's body, but it's that whole public health, your family, your community. And with polio, it's the whole world.
Yeah.
It's like we got to get rid of polio, and now this dang COVID, I fear is just really like distracting us, and I fear that we're going to go off track here with polio and a lot of these other progress that we've made over the past several decades.
Do you think we'll just get right into it, because I think now we're on the subject of COVID. Do you feel like awareness or value of public health is increased?
In my career, my 43 years career in this, we've seen so many emerging diseases. I think the biggest one was HIV. When I started, let me just go back to 1978. That was the year that the World Health Organization declared smallpox eradicated from Earth. And, before that, smallpox just ravaged. And then it was the vaccine. Like, I got the vaccine when I was a small child, and then I've had smallpox vaccination 5 times in my life. So we can do this. HIV emerged, SARS, Corona, MERS. Those are other coronaviruses. Here in South Dakota, West Nile came. Nile this year, that came. Zika virus came. Ebola, has hit Africa. I went to Guinea during the Ebola outbreak with the CDC to work on that, to be on that response team. Influenza, we've had pandemics of influenza, swine flu, bird flu, antibiotic resistance. And these are all things that science grapples with. And we learn what we're up against, and now we can get into it's not just the microbiology, but it's the molecular biology, it's the genetics, it's know so much now that, I never learned when I was, in graduate school or undergraduate school. So, and this is what will conquer COVID too. It will be the science, because listen, the sociological control mechanisms are not working in our country. Like we're running amok here. People don't know what to do. They don't know if they should or if they shouldn't, or if they do it, if that's politically correct, or if they don't do it, if their neighbor's going to scoff at them. And I just don't see the world that way. I just see it as, science. There's a way to do things, and I know science. It always evolves, and that's the strength of it. We're always learning more. And what might be today's dogma, there's scientists that should be out there trying to, test the negative hypothesis and disprove it and find something new about it. So you've got to be open for change. You've got to be intensely curious and always ask. Well, that's if you're in the research end of it. The public health end is very conservative. It's very applied. What I always tell my coworkers is, we in public health, we work on millions and billions of dollars of research. We stand with all that on our shoulders, and that helps us, do public health and do what we need to do. But it's going to be a science cure to this, and hopefully it'll be in the vaccine, because now we have COVID, a new coronavirus. A year ago it was in bats and a couple other critters, maybe, we don't know. And now it's humans. A year ago, none of us had immunity to this. And still most of us don't. There's no immunity, no vaccine, and no specific treatment. And it's pathogenic. What do we have here today? 132,000 Americans have died from it already. And that's putting it up to be, it could end up being, the second leading cause of death in the United States. I think in South Dakota, it's probably going to end up being maybe, I don't know, number 5 or something, behind heart disease and cancer deaths, but it's going to be a major public health and medical event and life-changing events for many, many people.
Yeah, let's go to that. I want to talk about your 20 years as the state epidemiologist. You talked about when you just talked about COVID there, some of the challenges in the society to get people to buy into the science. Do you have anything in your 20 years that was so new and foreign that you had to struggle with the communication of best practices, or how to get people to buy into these public health concepts? In many ways, these are fundamental public health concepts.
Well, I guess one of the things is antibiotic resistance. And that's more working with the physicians and the veterinarians about that. But I think for the general public, probably West Nile, because we'd all been living our happy little lives here in South Dakota, annoyed by mosquitoes every summer.
Forever. Yep.
Here's my fly swatter. I've got a fly in the house. But you know how it was. And like when I started, let's just go back to the year 2000. There were probably a half dozen communities in the state that actually had a mosquito control program. Boom, West Nile hit. And people were absolutely unaware of, unbelievable that a mosquito could actually carry a disease. Like they knew something about malaria. You study about that. But that was a new concept. So you had to educate people. You had to educate physicians and nurses, like what was the infectiousness? Could West Nile be transmitted to a physician and a nurse when they were trying to take care of that person? No, it's not like COVID. It needs that mosquito. And then the general public, like you could maybe buy 2 or 3 kinds of mosquito repellent here in South Dakota at that time. And it was usually, in the pharmacy or for campers or in some special location. And few people actually used it. Towns certainly weren't doing mosquito control.
Sure.
Or mosquito, what do you call it? The place where they lay their eggs. Any of that site.
A nest or.
Yeah, or spraying, or no communities really had much of that, or if it was done, it was probably done haphazardly or just at random or at worst incorrectly. And so a lot of education had to be done, but people bought into it because people knew people who had West Nile. People knew people who knew people. We had cases in every county in this state back in 2003. Almost every community, from Sioux Falls down to the smallest city in the state, had cases of West Nile. And I had all that documented. And we had buy-in from the communities. The state legislature, they passed, they gave state money with these mosquito control grants. We had seminars, we educated. And now what was like that first year, it was absolute hysteria. People didn't know what to do. And now, I must say, complacency does take over with all these diseases. And, we, go on and we live our lives. And I assume that's what we'll do with COVID too, at some point. So, and, influenza hits us every year too. And, people pretty well know, the flu shot will help you out. It'll make you less sick and it's helpful. But yet we have, I don't know, what was it last try? Maybe like 55% of the adult population in South Dakota did get the flu vaccine.
Wow,
so
that's high.
Where's that other 45%?
Oh, I thought you were going to say got the flu. Only 55 got the vaccine.
Yeah. And it comes every year, and we kind of know, what we should do. Like, don't be sneezing out at people, and stay home if you're sick, and all that kind of stuff. But yet there's a certain complacency with it, and we lose our fear of it. It's like people who don't wear their seatbelt. We got a lot of them in South Dakota.
So tell me, you're a science guy, clearly, and probably for someone like you, it's so black and white. You look at the research, you look at the data, you do X. But as a state epidemiologist, you're also a leader, and you got to throw in politics, you got to throw in education, you got to throw in communication. How do you navigate? How do you explain? How do you talk to someone who isn't a science person? Maybe they view it more as a political, economic thing, to explain that science when it's so clear.
Well, just make it as simple as possible. Like in my position, I was required, just write a quick summary for the Secretary of Health or the governor or physicians or something, and always make maybe 6 bullets, no more than 10 words. Just distill it down to that. What do you need to know? What is it? What disease does it cause, and how do you prevent it? And then, present that, present it to the secretary, present it to the governor. And, I was never the policymaker. I was always the science guy. And you try and explain to them, weed through the, minutia of the science and say what we need to do here in South Dakota. What I always found, we always got good national guidance from the CDC, the Centers for Disease Control. And then we had to distill it down and South Dakotaize it, make it applicable here. Don't change it unless we had absolute compelling evidence. And by evidence, I mean data, why South Dakota is different than the national. And in all my years, I found we never were. We're out here in the middle, but we're diseases that hit Florida or Washington State or, those viruses, they do the same thing here. And, just follow what CDC says. It takes weight off our shoulders because we don't have to figure it out. We don't have to start from zero. How do we apply it here? Is it an education thing? Is it a resource thing? Do we need some money for it? Do we educate the physicians and don't really have to, the healthcare workers, and we don't really need to raise awareness among the population? It's how you just jigger these things. And
interesting. Yeah. So what would you say to someone? I think part of it, you touched on it, but part of what's been so challenging here in 2020 is that this is so novel and we're still learning as we go. So how would you say to a leader, whether it be just like a business owner like myself, a governor for the state, even a parent, how do you say to people? It seems like each day we're it seems like you can read one article that says this and another article that says the exact opposite, right? How do we wade through the knowledge and find fact from fiction?
You stay tuned and you listen to the scientists. And what should be happening now is there's all this science going on. Some of it very good, some of it a little iffy. And then it's CDC's job to distill it down into good, solid guidance for us. Should we wear a mask? Should there be a vaccine developed? What about this so-called social distancing, drug regimes, and things like that? It's CDC's job, and Dr. Fauci, those kinds of people. It's their job to distill it down into something that we, the common people, or the common healthcare workers, or epidemiologists, or public health people, or the general public actually use and apply to our lives. So just really pay attention. Don't be distracted by all the nonsense you hear on TV or on social media or things like that. Just, really make a conscious effort to be discerning. And for people like in my old position, I guess a good science training, you learn to weigh the evidence. You learn to read, the medical journals, and, learn how to explain things and distill it down into things that are useful, because some of the things are pretty difficult to do. And in public health, it often doesn't entail like taking a drug or a vaccine, but it's actually lifestyle things or nutritional things that you have to do, or the seatbelt, for example, or not smoking. So it's, public health is messy. It's anybody wanting to go into public health know that it's just a messy discipline, because it's science, it's sociology, it's politics, it's statistics, it's just a lot of craziness that goes on in it. It's sure. But it's great fun, and it's absolutely fascinating.
Well, and it does seem, I'm hoping, you even mentioned that, I think, in that Augie article, how do we inspire the next generation of people to get into public health? Because it may not be something that they even consider as an option. And right now I'm thinking we want our best and brightest in the public health space.
Oh, now is the time to get into it. Oh boy, get into it and start out broad. If you like, I'd say if you like biology, like if you're a high schooler and you're just, reading your biology book in the evening when you don't have or looking at the flock of birds out there, or the ants crawling across your kitchen floor and wondering where they come from and where they're going, just go into science and start broad. And then as things catch your, it's more than just like getting an A in something. It's like what captures your soul, what captures your heart, and that'll be your interest. And then follow it. A vocation will find you if you're open to it. Like, don't just accept a job like, oh, I just want to be, I don't know, like just something I can make enough money on to buy a house and buy a boat. In Pure, everybody buys a boat. Don't just take that, but actually, follow your heart and find your vocation. That's what's going to keep you engaged your whole career.
I love that. So let's talk about that, because I think this is such a cool part of your story. After doing 20 years as a state epidemiologist, you decided you kind of wanted to come full circle, and you went back to Madagascar. So tell us about that experience.
Well, yeah, I wanted to do, grassroots again, because when you're working in the state health department, the state epidemiologist, you're always two steps away from, the people, really. And so I wanted to go full circle and not be in charge of anything, really, and not be
accountable.
Yeah, just do grassroots. So I thought, Peace Corps would be a good option for me. And I did not want to go back to Madagascar. I wanted to go to some Asian place or something. But then I talked to the recruiter, and they said, well, once you get to be a certain age, you don't learn languages so well. And since you already know the language in Madagascar, that might, and the job description worked, it was something that I was very interested in because it was public health. So I went over there, and then the first 3 months, it's a 27-month gig actually. And the first 3 months are training where they do the language. And then since I knew the language, I could kind of skate through that. And since I'd been working public health for 40 years, I could kind of skate through, that. But I was living with all the millennials. There were 45 of us that went out, and all but 3 of us were millennials. So here I was, like stuck in this frat house with all these people. And that was actually quite the deal. That was different than I expected. And then after the
it's like hanging out with a bunch of Andrews, your son, right?
Well, younger than Andrews.
Okay.
These are 23-year-olds, and these are like Andrew's even an old dog compared to them. But then after those 3 months of training, and then you get sworn in, and then you go out to your village, and that's where you are for the next 2 years. And you live in a little house, whatever the community provides for you. The idea is you live at the level of the community. So most have no electricity. I didn't have running water. I fetched my water from a well, threw a bucket down the well, and had a gym pulley it up, and an outhouse, and no air conditioning certainly or anything like that. And you just live, with the people. You live like the people, and that's kind of trying because everybody's. You live in this little place, and everybody's got their nose in your business. Everybody knows exactly what you're doing. They see your clothes hanging out in the line, and they know when you come and you go, and Madagascar is very so. Yeah, but got to distribute a lot of bed nets, thousands of bed nets. Malaria is still endemic there. We had a big measles outbreak while I was there. The nutrition, the hygiene, the sanitation work that I was able to do out there. I dug 2 wells, built a water tower for the little health clinics, and now the little health clinic where I was out in this rural area has running water. Hooked that up, so I was able to accomplish a few things. But with Peace Corps, half of the goal is just the cultural exchange thing, having this American, live in the community with the people, and they get to see you and you get to see them. I guess if you're young, maybe it's more exciting, but being an old dog, they call me grandpa out there.
Well, I think that's so great. You were at that point, right? Living in Pierre, you probably could have bought your boat and just sat on your boat. You decided to get uncomfortable and go to the other side of the world.
Yeah, in Pierre, that's what most people do. Yeah.
So I think that's so admirable to always kind of push yourself and go on the next adventure. So, what did it feel? Did it feel familiar after all those years, or did it feel different?
Well, a 20-year absence, I wasn't sure how much of the language I'd have, but it comes back after a couple of days or so. It starts coming back. But yeah, it was, things had changed. Madagascar is one of the poorest countries in the world, but everybody has a cell phone. You can buy one of these little Chinese cell phones for about $10 or less. Everybody has it. They've erected, what do you call it? Towers or antenna towers all around the country. So and that has changed people's lives, because before, if you were out in the boondocks, you were isolated and you didn't get to town other than every couple months or something for, market day or something like that, or a festival. And now people are much more connected. And so, yeah, there were a lot of changes, but poverty still, people are very poor and struggling to get by, and healthcare has improved from the time that I first went out. When I first went to Madagascar in 1978, the life expectancy of a woman was 49 years. Now, today it's 68 years.
Oh my gosh.
Yeah, so it's increased by 19 years. So to me, that's phenomenal success. If you were just to walk out to Madagascar and open your eyes and say, "Oh my goodness, this is just terrible. People are poor. It's what are we ever going to do?" But then you look and you see that progress for the people have been made, and for most people, I hate to make a cliche out of it, but people live joyful lives. People live in hardship, but life and family and growing your crops and living, people really find joy in that I think a lot of times we Americans, we miss. We live in, well, like I got my house here in Pierre, and you come in, you shut the door, and you sit in the air conditioning, and you don't see your neighbors. In Madagascar, everybody's out front, cooking and washing your clothes, and people are walking by, and kids are coming, and your chickens are right. Oh my God, the chickens, they're right there, and the dogs. It's just you're just living your life, and it's more community. They know how to do community work. For us, we have to make purposeful effort to do community, and it's through community that you do public health.
That's great.
Now I'm back, and I called him up and I said, "Hey, I'm back. I know you want me to do."
I heard there's this little thing going on.
Yeah. So yeah, I thought I'd go back and work for a month or two, and now it's been over 3 months that I've been back there working, and I don't know. I'm I'm trying to stay quiet because I'm, just respecting my boundaries, as much as possible, because I am retired, and I want to be, I'm trying to learn my place. And I think that's advice for all of us. We should learn, when to speak and when to keep your mouth shut. And I think when you're 68 years old and you're like, I don't know. It's time for the young people to do it. It really is, and they're doing it, and I'll just do my little task that they assign me to do, and that takes me about 7 hours a day, and I'm happy to do that.
Well, that's another admirable trait of a leader, knowing when to pass the baton and when to sort of, give up the power and control. So I'll instead of putting you on the spot, I'll say it this way instead. If you had suggestions or recommendations for what we should be doing as a society or as a state, how can we better respect and take care of our community right now during these COVID times?
Oh, well, I think just starting with your own family, make sure that your elderly parents are good, because my mother's living up in Selby, and she's 90 plus years old, and she's good. She's in a good place, so she's taking care of herself. But that's the first thing. And then your children, make sure your children are.
Here they are.
Okay, hi, how you doing?
Joining the podcast. This is Margot.
Yeah, so it starts with taking care of yourself. Build a little bubble around yourself. Know how to keep some distance, and know how to keep the virus at bay, and then your family, and then your neighbors. If you've got neighbors and some people are really afraid to go out and go grocery shopping. I know here in Pierre, you go grocery shopping and you're maybe going to get exposed to something. I don't know. And people are just afraid to take any risk. Like, see if they need some help, like getting groceries or picking up or taking something to the post office or something, just in your small immediate community. And then support the people who are really, really working hands-on with it. And by that, I don't really
that's good.
mean us in public health, but the people who are taking care of the sick. This is really something for them. So people who are in our hospitals and our clinics here in South Dakota, they're everybody that walks through the door. We're supposed to be wearing a mask when we go in and having our temperature checked, but they're really vulnerable. They're vulnerable themselves, and they've got hard work. You're dealing with a population now that's frightened, and it's a new disease. We don't know how to deal with it. And so be supportive, follow directions that are given to you, and don't try and buck the system so much. When I see people just yelling at people who are trying to do the right thing, and don't do that. Be tolerant of each other.
Well, I want to transition to a few rapid fire questions for you here at the end. So I don't know. Are you a big reader? What type of book are you reading right now?
Well, I am reading. I am a reader, and I guess for the past 20 years I've been so busy I haven't been able to read like I should. So I'm going back into this library that I've accrued. Believe me, I've got a whole bookcase, a whole wall of bookcases. So here's what I'm working on now, and this is The Deadliest Enemy: Our War Against Killer Germs, and this is by Mike Osterholm from Minnesota, and it deals with this whole thing. He's got a section here on coronavirus, and so I like nonfiction. I like biography and history, and I like to read about diseases and how they've shaped us as a society, and so that's what I'm into. I mean,
so even for fun, you still read about epidemiology?
Yeah. However, last night we did watch Hamilton
nice.
on the television, and I got to say that Lin Miranda is a true genius. I had heard the songs, but to see it, it was it was just genius. That's all it was. It was.
That's great.
Really enjoyed it.
Osterholm there is actually a Luther grad where I went to school. So another Midwest person there.
Yeah, and he thinks about this like this is his career. He dedicates himself to thinking about pandemics and outbreaks and things like that. Whereas I'm more of a generalist and all over the place, but he's honed down in. So I'd say listen to what he's telling us.
Interesting. So a question that we always ask when we do interviews at my company at Lemonly is, what's your superpower? Meaning, what's the one thing you do better than anyone else? What would you say is your superpower, Lon?
Maybe to be patient, which sounds kind of weird, but I think working in a country like Madagascar for so many years, it's just patience and thinking several years ahead. If you want to launch a project, like be several years in thought ahead of the people you're trying to convince, and then just be patient because you know that this too shall pass and it might work out. So I think patience is what patience and forbearance.
That's good.
Especially in times like this.
Absolutely. So I got connected to you through your son, who I know, a friend of mine. I'd like to ask parents, what's a piece of advice? I'm a parent of, you heard her here earlier, of young kids. What's a piece of advice that you would give to parents?
Well, I don't have any. I don't have any grandkids yet. Andrew, unlike you, does not have any children. So I keep telling him, man, you've got to get married here. But
I'll send him this podcast.
Oh no, his crazy career though, this filmmaking stuff, it's a very volatile thing. So, my advice is just, let your vocation find you. You find your vocation and let it find you, and do something. Like I should have put my foot down when Andrew wanted to be a filmmaker and just said, no, go into science. I'm not helping you at all. Like go to law school or medical school or entomology school or something. But he doesn't get discouraged. So my thing is, your kids have to, follow the vocation that finds them, and that's following your heart and your aptitude. And you might not be any good at it. Well, then you got to change it. You got to be something that really captures your intellect and your soul, and to make you good at it, and then follow it.
And And he clearly loves it, right? It's very clear when he's doing it that it's his passion.
Yeah, in fact, that's what he's doing right now. He's doing a little music video for a kid from New York, and he's doing it right now. He just started, so I have to go out. And he's doing it here in Pierre, and
that's great.
Yeah, so.
So I always like to learn from leaders about who inspires them. So mentors, leaders, teachers, who are the people that help shape who you are?
Well, I think going back to my dad died 50 years ago.
Okay.
But he was a World War II vet, and we talked a lot about the war and where he'd been. He'd been in North Africa. He'd been in Italy. He'd been in Japan. He was in the Navy. And that's why I got this map here behind me, because, I just wanted to go to all these places and do what he did. So his, untimely death, he was very young when he died. So my dad, first of all, and then your teachers along the way. And it may not be a permanent mentor. It may just be that one little lesson or that one little word of encouragement that they give to you, that helps you along the way. And then, of course, I guess for me, like my PhD advisor, Dr. Richard Seed at University of North Carolina in Chapel Hill, having long discussions with him on parasites and disease and control and disease modeling and things like that. And then him reading my dissertation and knocking me down and admonishing me and encouraging me. I'd say, Dr. Seed, definitely. And then Dr. Stan Quanbeck was in Madagascar, an older physician out there who'd been there his whole career and just like plowing the way and how to work. So I've just had so many people that I've looked up to and modeled after. And
that's great.
In science, in faith, in lifestyle.
That's great. So the last question I want to ask, you touched on a few things that kind of made me encouraged. You talked about patience. You talked about science and figuring this out. It's all this doom and gloom, and I feel like we've had a lack of leadership in terms of positivity and that we're going to get through this. What's something you would leave us with to say that makes us feel like as hard as this virus is and challenging as these times are, that we'll get through it?
Well, the human species, we've always gotten through it so far. It may change us completely, but we will absorb this virus. It'll probably get all of us because none of us have immunity. So it'll make a lot of us sick. Some of us won't get sick at all, but will still be infected with us. Some of us will become very sick, end up in the hospital, and some of us will die from this. But we will get through it. So as horrific as it seems now, there's been worse. And I can attest from Madagascar, where the hospitals are, much poorer. They don't have ventilators. They don't have personal protective equipment like that. But we here in America, we're very much blessed with this, and we will see the end of it because it's only a virus. It's only a virus, and we've dealt with viruses before, and we've got to learn to accept some hardship. We've got to learn to accept death and discomfort and disease too along the way.
Yep. Well, I appreciate that, and I appreciate your time. I appreciate your ability to go on an adventure, no matter the age and no matter what corner of the world. So thanks for the time and for sharing some of your wisdom with us today.
Okay, thank you. Good talking to you.
So that was episode 6. Thank you to Dr. Kightlinger for coming onto the show, and thank you to you for listening. If you can, try this. I want you to take a screenshot wherever you listen, whatever podcast player, whatever platform you listen to podcasts. And if you're an Instagram user, go to Instagram, add that screenshot to your stories, and then tag me at John T. Meyer. Tag me in that post. And I'd love to hear any feedback, any comments, your favorite episode. And I want to continue to get better, and I want to engage with those of you who are listening. So I'd love to have you do that. And until next time, have a great day, and thanks for listening to the Leadmore podcast.